Hi everyone, welcome to Queen's Conversations. My name is Lucia Dragos and I'm a supervising producer at Queen's Public Television. With me are two of my production colleagues, John and Noran.
Hi everyone, I am Noran, a video journalist and producer at Queen's Public Television.
I'm John Collins. I'm a producer, director, and instructor at Queen's Public Television. And yes, Noran, I always clean up when everybody leaves as well.
Today's topic is education in the new normal. And our guests today are Monica Sandra, public school teacher, Daniela Alexandrova. She's an MD pediatrics and ER medicine board certified. And we have Stacy Gautier, principal at the Renaissance Charter School. Welcome, everyone.
Thank you. Thank you for having us.
Thank you.
And we are live from 3 until 3:30 on our channels and as well our Facebook page. At 3:30, we'll start answering questions that you might have for our guests. So please make sure you submit your questions in our Facebook page, facebook.com/Queen's Public Television. So let's get started. Welcome, everyone. And my first question will be to Ms. Gautier. What is the latest that parents need to know in relation to school opening? And I know the surveys, the parents have to fill out the surveys. They have to be submitted by August 7th. How is that affecting the decision of the school reopening? So if you can go a little over the latest.
Sure. Well, the latest is a little different for district public schools than for charter public schools. Charter public schools can actually set their own calendars, but most of us are following similar to what the New York City School District is doing and surveying our families with whether they would prefer remote instruction or to come into the building, or be able to open the buildings at all. Right now, I can speak for Renaissance that we have about 50% of our parents who are saying that they would like their child to learn remotely, at least into through the fall, possibly even a little bit later. And that's where we're at. We're really, all of us are supposed to have our reopening plans in place to the health department by tomorrow. And we will, but we have been told and are treating them as very living documents. So the plan that we submit tomorrow, based on what happens, could change very radically next week.
So these changes, will they require additional staffing, and how will you budget for that?
So we think so, and there is no budget for it really. We did all get some money from the CARES Act that was comparable to our federal money that we get. And that money can be used for professional development. It can be used for extra technology, which I know most schools had to invest in. We certainly, Renaissance, we invested almost $90,000 to make sure that everybody has a Chromebook if they're learning at home or even in school, where they have to do a level of remote learning. And we also have to purchase all the PPE currently from that money. So we're expected to provide masks or face shields, thermometers and scanners and anything we need to keep it safe. In terms of other staffing, there's a huge push from school administrators and teachers for every school to have a nurse. Every school has not been promised a nurse, and that's very, very concerning. I would be very concerned to open my school without a nurse in the building.
Why there will be no nurse, or possibly?
There's a few different reasons. There's not enough nurses apparently in the city to actually cover every school. Even pre-COVID, many schools don't have nurses. The nurses are also potentially seeking some types of accommodations if they're nurses with health issues, because that's another piece of all this. All staff in schools are actually allowed to request accommodations, and those accommodations usually mean they want to work remotely. I'm not exactly sure how a nurse works remotely. I'm sure there's things they could do, but it's going to leave a large gap in the needs in our building with all the requirements that we have to do related to COVID. And if we suspect the student has COVID, there's a lot.
Nutrition, Dr. Daniela, what do you suggest children should be going to school? And with this case of not there being enough nurses, what do you feel like would be the best step for parents to take for their children, since they get to vote if they want their child to go to school or if they could do it remotely?
I mean, I'm not in a position to say what needs to be done because there's so many models that have been discussed, and there's so many different countries in the world that have done completely different things. It's up to the government, Department of Education. But it's true that parents are coming every day and they're anxious, especially our little challenged patients with the special needs that are falling behind their therapies, OT, PT, speech therapy. It's a challenging time, and we are getting ready to prepare all these kids to go to school. We're acting as if they're going to school. So even though in the months of March and April we were doing mainly telehealth visits, and I'm lucky I was prepared for that with telehealth visit. I was kind of prepared and pushing for this tele visits even 2 years ago, but now the parents were not as reluctant as they were before. So they were accepting it, they're learning how to do it. So we are a lot more flexible, and the telehealth visits have increased by 50% compared to years ago. So this is a new way of practicing medicine. Of course, you cannot compare or replace face-to-face visit. And speaking about the nurses, lacking nurses in the schools, we're here to help. And we're now working at least the private sector at a full capacity, 100%, because I cannot speak about the rest in H&H, where they're seeing a little bit of less patients in person. We're preparing the kids. We're doing all the immunizations. Even in the first 2-3 months, we were recalling all the kids under the age of 2, trying to catch up with their vaccines. Because yesterday I read an article of American Academy of Pediatrics. As of now, in the United States, 50% of the kids are behind their immunizations, which puts us at a higher risk for diseases like measles and pertussis, and even polio, where we depend on the herd immunity and immunizations. So we have to, it's a very delicate situation. Am I advising the parents to go to school? Obviously, for the middle classes in high school, colleges, yes, they can control themselves, they can wear masks, they can practice social distancing. So this is not going to be that challenging. But for the pre-K, kindergarten, daycare, it will be very difficult. You can't control them. You can't, it's not even safe to wear a mask when you're under the age of 2. So our toddlers and children and babies, they're already coming with all sorts of diseases and rashes around the mouth. I had yesterday a case where the father was so concerned about his child being presenting with speech delay. So he was asking me to excuse him from wearing the mask. And I agree. First of all, the child will not be able to mimic the speech and the lip reading. And second, this mask will even create more anxiety about this child who is already behind his speech. So if there is something like I am for personally the hybrid model, where perhaps the kids can do 2 days of school. Some countries in Austria, Denmark, Scandinavians countries are closing Wednesdays, where they can disinfect and provide deep cleansing of the building, and then the kids are going back on Thursday and Friday. There are a lot of options. But we should find the golden middle and see what is safe for obviously our children and parents.
Have you seen any,
Yep.
Have you seen any cases of reinfection?
Reinfection is very rare. I had one child who presented with reinfection, and we proved it because he was sick back in March, was admitted to the hospital. Then developed partial, perhaps, immunity, got better. And lately, the last 2-3 weeks, was back and forth my office and ER, and retested positive, even with the IgG positive antibodies. So yes, this is positive, but it's a very small percentage.
Monica, you've been a teacher for many years. Based on what you know about children in classrooms, what expectations do you have about their reactions to the new protocols of masks, distancing, reduced movement and interaction, etc.? And what steps can you take to alter the physical structure of your classroom to accommodate some of these?
Well, right now, the guidelines for social distancing is 65 square feet per person, which means that we have to have 6 feet of distance between each other. That puts us in a situation, given the average size of the class, perhaps maybe 9 or 10 children plus the classroom teacher. So we're looking at those numbers as of now. As the doctor said, for the little ones, I do predict that it is going to be very difficult to train them and to have these masks on for a long period of time. So for the little ones, I do predict it's going to be very difficult to keep them distant from each other. As we all know, they're children and they gravitate towards each other and they want to play with each other and they want to interact with each other. As teachers, we will be trained and therefore we will have to train the children, to follow the guidelines given to us and ensure that social distancing is in place at all times, as well as keeping masks on, et cetera. But there is definitely a challenge. There will be definitely a challenge to address.
Are most of the public school teachers also going to be required to conduct the online courses as well as their in-person courses? And are you prepared for that?
Yes, we are definitely prepared. We launched, remote learning back in March. We only had like 4 days to launch this, and we definitely did. It was a challenge, but we definitely pulled through. And right now, the Department of Education is planning on reopening with blended learning. As we know now, blended learning will be some days in brick and mortar and other days remotely. Parents do have the option to opt for remote only for their children, but the blended learning is, the plan that the DOE has launched, and that's what we're all organizing and planning for.
So for many children, they have to have that interaction with their teacher. And I know that teachers have 4 days to change into remotely. Using that experience, did you feel as if there was a lack of interaction with the students? Because if they're attending class or if they're finishing the assignments, do you feel like that's holding them back from giving in their all as if they were in a classroom?
There is nothing more effective than children going into the classroom and being in front of the teacher and having that direct interaction with the teacher, okay? And the teacher having that direct interaction with the student, okay? Absolutely, there were challenges there, especially with parents, trying to get the parents, to use technology. Trying to get the parents to get their children on a schedule, and Zoom and joining, in these live sessions with the teachers. That presented, a very huge challenge. So regardless, however way you want to slice it, there is nothing more effective than going into the building and having children in front of the teacher and the teacher interacting directly with the students, obviously. But considering the global situation that we are facing, we can just do the best we can with what we have at the moment.
Hey, Stacy, let's go away from the classroom for a moment. The kids, generally, many of them rely on busing to get back and forth to school. What kind of changes to the buses do you anticipate may happen to protect the safety of the drivers and the children? And also, I'm sorry to double up on you, they have to be fed the school lunches, and what procedures have you developed to handle that situation?
Well, as far as busing goes, right now we have not gotten actually confirmation that busing is going to take place. And this has been a huge concern for administrators and staff and for our families that depend on busing to get their students to school. So we're waiting on that information. It'll be a big challenge if for some reason that can't be pulled together and our students don't have transportation. I think it would probably be one of the worst things to ask all of these families to go onto the subway, because I know people also have concerns about that. So let's just hope that they get busing together. Once they get busing together, they should practice all of the same social distancing rules that we're asking them to do everywhere else. And they should be wearing masks on the bus. They should have the seats spaced, which might mean more busing. So I would assume that busing is going to cost more money. That's my guess. So as far as school food, I feel pretty prepared for. At my school, we're our own school food authority, which means that we don't depend on the DOE. But even during the first wave of everything, the DOE did have food sites for families. During this time, whether we're fully remote, whether we're blended, hybrid, we will have meals available for all of our students. We will have breakfast, we will have lunch, we will even have supper. So it'll be bagged food that they can take home.
Exactly.
And we'll continue to support our families who actually, need to have more, more opportunities for food. We know we have a pretty needy population, and we will link our families up with the local food banks in other areas to make sure that food is not an issue.
I have a question for some teachers are preparing to possibly strike. What are your thoughts on that? Since the school did a survey and the decision is yet to be made, now with the possible teacher strike, how isn't that defeating the purpose of the survey and all the work that has been done till now?
So are you talking about the teachers talking about striking?
Yes.
Yeah. Well, look, here's what I think. I think that the unions are making very valid points and raising very valid concerns about the things that need to be taken care of. I don't think that most of us disagree. The fact that it's the end of July and we don't know if we're going to have nurses in the building, and we don't have confirmation on all the cleaning protocols of our space. I mean, I agree with the doctor. It's like there are a million different models. Well, let's pick one and stick to it and confirm we're going to do it. I think people would feel a lot better if they knew the space was going to be disinfected so many times a day. I know myself, for our building, which is a closed air building, I've been writing and communicating about the types of filters and the inflow of outside air that's going to be coming into the building. So we have concerns. Am I concerned about teachers striking? Sure, I am. But I think if it gets everybody to, move a little bit quicker on the things that need to be addressed and or possibly even delay the opening of school, I hope we don't have a repeat of last year where we have one day to try to figure out a new model. We're all working really hard. I mean, I know, as the teacher on the panel said, we're preparing for everything, but we all want to do our best job, teachers and administrators and school staff, and you need a little bit of time for that. So am I worried about it? I guess yes, but I think the reasons behind it are very valid, and I think that my gut is that it will work itself out, and I think the fact that we're raising these issues is very important, and everybody is showing people that these are important issues and they can't wait till the last minute, even though we could be very prepared and COVID is going to do what COVID's going to do. So we could be prepared to go back in, and then if there's a spike in New York, and we could go back in for a month and have to close again. So yes, flexibility is the key, but I don't have any animosity towards the teachers for taking a stand about wanting to make sure that they're safe, their kids are safe, and by extension, the families are safe.
Let's continue with some questions. We have 2 questions from parents. I'll just ask that, but I think maybe that's for the principal or Monica. How exactly will working parents who cannot afford nanny care will deal with kids being out of school for 2-4 days a week? Is that a toll on the social, emotional, and mental health of these kids much greater than the danger of the virus, since kids tend to have mild to no symptoms? Well, anyone can answer that question.
Okay, I'll take a stab. We are definitely concerned and know that childcare is an issue, and we understand the bigger issues of families needing to go back to work, and all the problems that families who are unemployed face in terms of poverty and social emotional issues. So it is definitely our position that we would love to have our kids back in the building, which is one of the reasons why we are surveying our parents and hoping to be able to accommodate them the best we can. But that said, there still has to be safety first. If we don't feel like our building is a safe enough place because of things that have still not been worked out, we think we'd be doing a big disservice. We are asking to see if our families might be entitled to participate in any of the district rec type centers if they have them. I know that they are looking at child care options. And again, this is another question that's still out there and open. And hopefully we can accommodate most of the families that want to come into our building. And, I feel like we still have 6 weeks. And unfortunately, the one thing we've learned with COVID is that nothing happens way ahead of time. But I absolutely do sympathize, and I know it's a problem. And I hope our families know that, we are making those considerations and feel like coming into the building is the best thing for kids, for all kids, not just those who need childcare. I, in some ways, have to say, worry more about those high school kids who are home alone, who don't need childcare, but they're home alone all day, not having any sort of structure in the building.
Yeah, and mental crisis, I'm sorry to interrupt, but this on the rise. We're seeing every single day. I'm getting calls and I'm doing telehealth visits with anxious children. When we do the questionnaire, the depression questionnaire, most of them do qualify for mental health, unfortunately. And this is every day. And once a week, I have to, unfortunately and sadly, call 911 to refer somebody to psych-ER.
Do you think that's from the fear of going back to school? A lot of children.
No, this is mainly isolation. Isolation from one hand, and from the other, being in an abusive family. Spending so much together, like a lot of Queens, as you know, it's a crowded area. We have big extended families living together under the same roof, and a lot of parents are left without jobs. A lot of my children lost a parent. We have abusive parents, so there are many issues that should be addressed. But it's very sad that we have to be dealing with this, and we're prepared, but we still have to do our best.
Monica, any thoughts on that?
I agree with yes, I definitely agree with everything that has been said by the doctor and also by the principal. And our the Department of Education's focus right now is to address social emotional needs. So I know that the chancellor has mentioned that the first 2 weeks will be dedicated to social emotional needs for our children as well as for our parents. We know that our community has been affected tremendously. We do have a lot of parents that have lost their jobs, are jobless. Poverty, is definitely apparent in our community. And so our, social emotional needs will be definitely addressed. And as far as having daycare for our children and for our parents, that is pretty much one of the top priorities and concerns from from not only parents, from teachers as well, teachers that also have children like myself. What are we going to do when we're in the building teaching? What is going to happen with our children that are home for 2 or 3 days? So I know that the chancellor has been looking into this. I know that the mayor has been looking into this, as well as our union president, Michael Mulgrew. So that has been one of the top, questions and priorities that they have been looking into, and they're, trying to figure it out. So we're still awaiting guidance. Am I afraid to go back? Personally, I am not, because I am confident that everybody involved, the powers that be, the Department of Education, our union, our governor, the mayor, they will make the right decision for us. If we are ready, if this COVID leads for us to be able to go back safely, and our buildings are safe and everything is in place. Nurses are in our buildings. The ventilation system has been fixed, and every other logistic that needs to be in place is in place, and we are safe to go back, then I'm confident that everything will be okay. But if this is not addressed and things are not put in place, and issues are still hanging, then we won't be able to go back.
So much for joining.
Thank you.
Stay safe.